Hey everyone, how you doing? So in today's video, let's talk about gum recession, and I'm going to show you the 5 most common reasons that someone might get gum recession. So to begin with, let's define what gum recession is. Gum recession is the margin of the gum, so where the pink and the white meet, okay, that's the gum margin, and it's the movement of that gum margin towards the tip of the tooth. We call it apical, and essentially that means the top gum can get higher and the bottom gum gets lower. Okay, so here's a photo of a lady. We can see she's got very uneven gums, and the gum on this tooth is much higher than the gum everywhere else. So cosmetically, this is a big deal, okay? But health-wise, it can be a sign of a bigger underlying problem as well. So let's look at the number one reason for getting gum recession, and this is what scares everyone. It's gum disease. Okay, so gum disease is essentially bacteria in the mouth which are irritating the gum. Okay, phase 1 of gum disease is just bleeding gums, and the cool thing is if you catch it at this stage, it is 100% reversible. But because gum disease doesn't hurt, and the only time you really think about it is when you brush your teeth and you see blood in the sink, then a lot of people will get passed down to the more aggressive types of gum disease, and that is where the bone is affected underneath. As soon as the bone underneath the gum is affected, and the bone doesn't like to sit anywhere near bacteria, so the bone is going to shrink away, the gum will instantly shrink away as well. Okay, so the number one cause of gum recession, I think, is gum disease. Okay, just because gum disease is so common. Another really common reason for gum recession is aggressive brushing. Okay, and I know this sounds weird because when you brush your teeth, you are expecting to promote health. Okay, and the people who we see this in are people who are fanatic at brushing their teeth. They want to do everything they can to not get gum disease. But in certain people, especially if they've got thin gums to begin with, and this is a genetic thing, if you've got thin gums to begin with, you're using an electric toothbrush 3-4 times a day, and you're being quite aggressive, pushing quite hard with it, you're actually causing trauma on the gums. Okay, so I'm not saying be gentle. You should definitely not be gentle, but you shouldn't use excessive force to brush your teeth, because this over time is going to cause the gums to recede away. Now, the thing about this type of gum recession is it's not an active disease. So what I mean by that, there's no inflammation which is causing the gum to shrink back. You just need to stop brushing so hard, and the gum may or may not recover. Now, another reason that you could get gum recession is after brace treatment. And I know, again, this is going to sound a bit weird because, again, you'd have brace treatment to improve the look of your smile overall. But recently, in the last 10 years or so, there's been so many companies which are promoting sort of braces to be done with a general dentist rather than seeing an orthodontic specialist. And the way that these courses, some of them, the way that they're being advertised is very sketchy, and some of the things which they talk about in their courses, again, it's not stuff that I really agree with, and it's not stuff that many specialist orthodontists would agree with. You see, there are risks involved with orthodontic treatment, and essentially if you've got a situation where you've got a lot of crowding, i.e. a lot of overlap on teeth, and you just stick a brace on, what's going to happen is all those teeth are going to expand forward. Okay, that what we call the arch form is going to expand out, and the bone isn't going to expand out. The bone's going to be stuck where it is. So what you can get is teeth tilting forward and out of the bone, and as teeth tilt forward, the gums recede down. Okay, now I don't want to scare anyone having braces. This is quite a difficult thing to do. Okay, teeth will resist this quite a lot, and I've done hundreds and hundreds of cases with orthodontics, and this has only ever happened to me once. Okay, so it's quite rare, but it is well known and very well documented. Okay, when we say well documented, dentists know about this as a risk. So that's one thing to be aware of. But again, this isn't a disease kind of thing. So if you do get gum recession like this, quite often, if the orthodontist pushes the teeth back in, the gum recovers quite quickly. But if it's an ongoing thing, then you might need some kind of gum treatment to rebuild the gum. So our next one is one which a lot of dentists themselves don't know about. So unless the dentist is doing a lot of complicated, what we call full mouth rehabilitation treatments, they may not be aware that an uneven bite can cause gum recession. Okay, so what I mean by an uneven bite is as you chew, okay, and as you bite, as you talk, your lower jaw moves in relation to your top, okay, and quite often when you're talking, your teeth aren't actually in contact, but your jaw joint will naturally sit in a certain position. Now, as your jaw closes, if one of your teeth hits before everything else, what happens is this tooth, as it hits, it causes a slide. Okay, your lower jaw will slide into a different position, and this causes a sideways force in the teeth where it hits, and teeth generally don't like sideways forces. So when you bite, you won't be aware of this sideways force because your body's really good at adapting and compensating for all this stuff. So as you're chewing, it will just feel normal, but you may notice that one tooth just seems to hurt for no reason, or it may be overly sensitive. Quite often, if you've had a filling or a crown done, then the bite isn't quite right and it feels overly sensitive. This is what the issue is. Now, again, I don't want to be scaremongering. I don't want you to think, oh my God, if I've got an uneven bite, I'm going to get gum recession. If you've got an uneven bite, first of all, just go and see a dentist. They might be able to sort this out really quickly and easy for you. But secondly, if you have an uneven bite, most people will have an uneven bite and it won't cause them a problem. Okay, it's only a small proportion of people who an uneven bite will cause, a lot of problems for in the future. Okay, but one of the symptoms, one of the things which you as a patient could see is that one tooth feels a little bit loose and the gum may shrink up on that one tooth, i.e. recession. Okay, and the last one is, maybe I shouldn't have put this last, it's fairly common. Okay, we're talking about these black triangles. The gum has shrunk up on this case here, and a lot of the problem here is the contact point, i.e. the shape of the tooth. Okay, so if you've got triangular shaped teeth, the contact point from one tooth to the next is much higher up, it's away from the gum. And there's been a lot of research to show that if this contact point is 5 millimeters or more away from the top of the bone, and we'll need to take an x-ray to see the top of the bone, then we're going to get this gum recession in that area. Okay, but technically it's not really recession, but it looks like the gum has shrunk up when the problem is actually more to do with the shape of the teeth rather than the gums themselves. So in these situations, if you're having braces, you could make the teeth more square and then pull them together, and that will move that contact point up nearer the gum, meaning you won't have these black triangles between the tooth and the gum. Okay, so again, I hope you found this video really useful. If you've got any questions, comments, leave them below. I do read all of the messages that I get, and you could inspire our next video. Okay, so consider subscribing, and I will see you next time. Take care.